So when a patient comes to see me for breast augmentation, I ask about their general health, and then we specifically talk about their breast. And what's important to ask is, have they had children? Have they breastfed? Are they done having children? Is their weight stable? Do they have a personal or a family history of breast cancer? And have they done any screening exams on their breast? And then based on that, we can have a discussion. If a patient's going to say, I'm going to have another child in the next year, maybe they'd be better waiting, to have the surgery. But if they're done having kids, then you could say, okay, let's talk about it now. Or if they're on a GLP-1 and they're still actively losing weight, we want their weight to be stable going into that. So you want to control everything you can so that there aren't all these moving parts going into the surgery. Once I take their medical history, then we look at their specific breast, we do the measurements, we use the imaging device in Vectra, and then we can simulate the different size implants. And in particular, I ask them, what is your goal? And a lot of women will say, hey, I like the shape of my breast when I was breastfeeding, and I just want about that size. And I hear that all the time. And so we can then do that and image that and morph that and say, hey, what do you think? This is about what your breasts look like when you were breastfeeding. And most patients say, yeah, that's exactly what I want. Or some people say, no, actually I want a little bit more volume, or no, I actually want a more conservative volume. So everyone's a little bit different. And so it is important to get their goals ahead of time. It's also helpful to look at pictures. So sometimes patients will say, I want a very natural breast augmentation, and then they show me a picture of a patient or a celebrity, and I'll say, well, that's not natural. And so we can have a very upfront discussion regarding that. And other patients, will say, I want, a fuller breast, and I'll look at the picture, and it's not that significant of a change. So again, just getting their goals out ahead of time, and then having a realistic discussion as to whether or not we can accomplish that.